Hello, today I will discuss about the antidotes. What are the antidotes? Antidotes are agents which counteracts the toxins. So, antidotes are the agents which counteract the toxin. Okay, so how it counteract? Okay, it counteract by neutralizing the toxin, by neutralizing the toxin, or preventing the absorption of toxin, or doing opposite actions of the toxin, opposite physiological, logical actions of the toxin. So we got the antidote. What is antidote? Antidote is an agent that counteracts the toxin. Okay. How they counteract the toxin? By neutralizing the toxin, preventing the absorption of toxin, doing opposite physiological actions of the toxin. Okay. Today I will discuss a few of the toxin and their antidote. Okay. First of all, let us start one by one. Number one is acetaminophen, and its antidote is N-acetylcysteine. Acetaminophen is called Tylenol in the United States. In India or in Bangladesh or in Pakistan, it is called paracetamol. Paracetamol. Okay. Its antidote is N-acetylcysteine. Then we'll go to the aspirin, that is the salicylates. Acetylsalicylic acid. Aspirin has no specific antidote. It has no specific antidote. So how we'll manage this patient, how we treat this patient who took a lot of aspirin accidentally or to commit suicide? Okay, so we'll alkalinize the system of that person. We give the sodium bicarbonate so that aspirin can be excreted through the urine very, very quickly, and we can do dialysis. Okay, so it is alkalinization. For acid, we do alkalinization. For the alkali, we do the acidification. In case of amphetamine is a CNS stimulant, and it is used by the celebrity. Okay, it is a substance of abuse also. So it also decreases body weight. Amphetamine. Okay, so it should be managed by acidification of the urine by adding ammonium chloride. Okay, so that will work to manage that, so it will be excreted properly. Then organophosphate, insecticide. What is the antidote? Atropine for the cholinergic part of the organophosphate to counter the cholinergic function. For the nicotinic function, for anti-nicotinic, we use the pralidoxin. Okay, that is the paradoxin. To counter the nicotinic action, to counter the cholinergic action, we give the atropine. Okay. Beta blocker. Beta blocker is an antihypertensive drug. It decreases the heart rate. Okay. It may be used in case of hyperthyroidism. It can be used in case of cardiac arrhythmia. It is also an anti-anxiety drug. Okay. So beta blocker, this may be selective beta blocker, maybe non-selective beta blocker, okay, like that of propranolol, or selective beta blocker like that of atenolol. Its antidote is glucagon. Digitalis is a medication used in case of congestive heart failure. Okay, congestive heart failure, it increases the force of contraction of the heart. Okay, that is the digitalis. It should be managed by, antidote is the digibind, and we must normalize the serum potassium level. It may need dialysis, but this is the antidote, digibind. Okay. Then iron. Iron can be taken accidentally, especially in case of children. Iron can be deposited in our body if we have some type of metabolic problem, or if there is very quick hemolysis like that of the sickle cell anemia or thalassemia. Okay, in that condition, there will be accumulation of iron plus intake of iron accidentally. So its antidote is defuroxamine. Heparin. Heparin is an anticoagulant. Heparin is an anticoagulant, and its antidote is protamine sulfate. Okay. Warfarin, antidote vitamin K. We must remember that. Warfarin is also an anticoagulant. Warfarin is contraindicated during pregnancy because of its teratologic effect. It may cause congenital birth defect. So the pregnant lady should not take warfarin. Okay, she should switch to heparin. Once baby is born, again she may go to heparin. Okay, so heparin is safe during pregnancy. Warfarin is not. Both of them are anticoagulant. It can be taken orally. It is given by injection. Okay, then vitamin K is the antidote for warfarin. Protamine sulfate is the antidote for heparin. Benzodiazepine. Benzodiazepine are the medications like that of diazepam, lorazepam. These are muscle relaxant, sedative drug, may be used in case of epilepsy or alcohol withdrawal syndrome. Okay, benzodiazepine. Okay, so they induce sleep and muscle relaxation. So its antidote is flumazenil. Opioid like that of morphine, pethidine, painkiller. Okay, so opioid, its antidote is naloxone and nalmefene, that is more potent than that of the naloxone, nalmefene. Okay, anticholinergic toxicity, especially we have a lot of anticholinergic toxicity. One example is datura poisoning. Datura poisoning, especially very common in India, especially where a lot of public gatherings, some miscreants may mix the datura with that of the food and may entertain other people and rob away everything. Okay, so datura poisoning, it is managed by means of physostigmine, because to manage the anticholinergic toxicity of datura, managed by physostigmine. Okay, Like that, if we have cholinergic toxicity, we manage that by atropine. Atropine counteract the acetylcholine. Okay, magnesium sulfate has many use. It is a medication to reduce convulsion. It can be, some of the magnesium is used to manage the stomach ulcer, peptic ulcer. Okay, its antidote is calcium gluconate. Cyanide poisoning. Cyanide poisoning may be in the industry like electroplating, maybe in the plastic industry. Cyanide is also present in the fruits, in the fruit seed like that of the apricot, or even in the apple seed. Okay, and it is present in the raw cassava if it is not properly prepared. Cassava is a very much staple food in some part of the world. Okay, so that contains cyanide, and it is managed by Pasadena cyanide kit. Okay, so what does it contain for cyanide? Cyanide we manage by a kit that contains amyl nitrite. Amyl nitrite. Okay, so one of them is amyl nitrate, sodium nitrate, sodium nitrate. Okay, sodium nitrate and sodium thiosulfate, and sodium thiosulfate, sodium thiosulfate. Okay, sodium thiosulfate, that is called Pasadena cyanide kit. Okay, Pasadena cyanide kit. Okay, so we got three components for the management of the cyanide. Toxic alcohol, how we manage toxic alcohol. Toxic alcohol may be antifreeze, or it may be wood alcohol. Sometimes people accidentally took those alcohol, or people may not get entry into the regular alcohol. They may take some toxic alcohol, maybe accidentally, maybe intentionally. Okay, it should be managed by ethanol or by fompijol. Ethanol or fompijol. So these are the common toxins and they are antidote. We have a lot of other things like that. We have heavy metals. We need the chelating agents. Okay, suppose lead. For lead, management of lead, we need the chelating agent EDTA. EDTA is the ethylene diamine tetraacetate, or British anti-Lewistic. Okay, we have mercury poisoning. Mercury poisoning is also common. Mercury poisoning. Okay, we need the EDTA, British anti-Lewistic, EDTA, and British anti-Lewistic. Okay, so we may have other type of heavy metal poisoning. May not be always same for all. Okay, like that of chromium. Okay, in case of chromium, in that condition, EDTA, British anti-Lewistic, may not work properly. In that condition, ascorbic acid may be the antidote. Ascorbic acid. Okay, we got that. So we have very common condition in the winter months, especially in the United States. Okay, that is carbon monoxide poisoning. Carbon monoxide, that is CO poisoning. What is the antidote? Antidote should be 100% oxygen. Okay, or hyperbaric oxygen, that is better. Oxygen, 100% oxygen, or better hyperbaric oxygen. Hyperbaric oxygen, unfortunately it is not available everywhere. We have no hyperbaric chamber in all the small cities. So 100% oxygen may work properly for carbon monoxide poisoning. Okay, we may add few more things like that of the, if we go to the venoms, any venoms like that of the venom from the black widow bite, black widow spider bite, or from scorpion sting, or from snake bite. Okay, so we have, for the venom we have anti-venom. Okay, for venom we have the anti-venom. Okay, now this world is moving too fast. We have some ionizing radiation toxicity is possible. Ionizing radiation. Okay, so some of them may be managed, like that of the plutonium. If person is exposed to plutonium, then antidote should be DTPA. Okay, so it depends on, like that of it is, if it is cesium. Okay, if it is cesium, then it should be, the antidote should be Prussian blue. Okay, so we may add few more, like that of the thallium that is used for the semiconductor or the jewelry, okay, or for the some type of optical items. It may also is a depallidation to remove the hair, or as a rodenticide, that is thallium, and its antidote venom, anti-venom. Thallium, we have the antidote Prussian blue. Okay, so it depends on what type of toxin is there. We must remember that antidote, not necessarily all the toxin has specific antidote. Suppose the aspirin has no specific antidote. Mushroom poisoning, some toxic mushroom poisoning, we may not have specific antidote. It may be supportive, multiple way we can manage the patient. So toxic mushroom poisoning has no specific antidote. Antidote may be toxic again to some individual, and the antidotes may not be approved by FDA of the United States of America. Something which is common in the Europe, it may not be common in the United States. Okay, that may be possible. So it is better to consult with the Poison Control Center. So to get best idea, we must contact Poison Control Center in the United States that is present. They will respond 24/7 every day, anytime. Okay, their number is, telephone number 800-222-1222, 222-1222. So Poison Control Center may be a good source to consult with the expert individual, especially medical toxicologist. Or we may also, another source to consult is the Chemtrek. Okay, these are the chemical manufacturers association. They have the telephone number 800 424 and 9300. Okay, so it is better to talk with the expert individual, with the medical toxicologist, to get the exact source of management, exact way of management, exact antidotes. Suppose we have a lot of snakes. Each snake has different type of poison, so it should be different. What antivenom we use for particular snake bite. Okay, so it is better to consult with the center. And that's all about the antidotes. If you like my video, please support my channel. Please subscribe me. Share the information with your friends. Any question, please feel free to ask me. And have a nice day. Bye now.